In general, I would say that homeopathy doesn't treat conditions, it treats people. A homeopath can give you a head start, but it's not going to take you too far if you continue to put kerosene into your car instead of petrol. In modern medicine, you have to keep taking the medicines lifelong for almost all conditions. Is really asthma a disease of the lungs? It's not true. So Buddha said, get me a grain of rice from the house of someone who has known no grief, and I will bring your child back to life. So the woman went from house to house. Did you have grief? And they told their grief. They went to another house. They told about their loss. And by the time she visited 6 houses, her state was healed. She never went back to the Buddha.
Hello, Dr. Rajan. I've been wanting to have you on this podcast for the longest time, and I'm so excited that today it's finally happened. Just for those of you who don't know about it, I'm an advocate of homeopathy personally, and everyone always tells me that my name on Shark Tank is Pharma. So there's always this misconception that people who are into allopathy or like me making allopathy drugs would not believe in Ayurveda or homeopathy, but I believe in both. But for those of the people who are listening to this podcast and don't know the basics, how would you in a layperson's term explain what is homeopathy?
I think the first thing that is to say that homeopathy is a system of medical treatment based on the principle that like cures like. That something that can cause a state in a healthy person can cure a patient who has a similar state of being. So our remedies, which are derived purely from plant, mineral and animal sources, have been extensively tested on healthy volunteers, and symptoms have been recorded, their state of mind has been recorded, the way they feel, they think, they eat, they sleep, everything has been recorded in detail in books called Materia Medica. And when a patient comes, we note all the symptoms from the head to the foot, how he thinks, how he feels, how he sleeps, how he eats, what are his physical symptoms, and then we need to match that with a remedy from our homeopathic Materia Medica that has a similar state. And when that match happens, healing happens. So this is how homeopathic principle is.
Fantastic. Can you give one example of like cures like?
If you want in a layman's term.
In layman's term.
In layman's term, it is said that when the Buddha was there, right, one woman took her dead child and put the body in front of Buddha and he said, please bring him back to life. And she was sobbing and weeping like any mother would. And the Buddha said, I can't do it. She said, no, you are Buddha, you can do it. So how to solve this problem? So Buddha said, get me a grain of rice from the house of someone who has known no grief, and I will bring your child back to life. So the woman went from house to house. Did you have grief? And they told their grief. They went to another house. They told about their loss, their bereavement. And by the time she visited 6 houses, her state was healed. She never went back to the Buddha.
Absolutely.
So when somebody is in grief, what do you don't go and tell them a joke, right? You go and tell them your grief, right? So when their grief and your grief, they come together, they match, then healing happens for both, in fact.
Absolutely.
This is a very simple example.
It's a beautiful example, and it's something I think everybody can relate to. So thank you for talking about this. Now, coming back to the science part, which are the common conditions that homeopathy can treat, and which are some conditions that you would probably say that homeopathy would not be the first line of treatment?
In general, I would say that homeopathy doesn't treat conditions. It treats people. And by treating people, it heals them, whatever be their medical condition. So you are healing a human being, not necessarily a pathology. And by healing the human, the pathology also heals.
Correct.
So therefore, I would say homeopathy can treat everybody. But can it cure everybody? Like every system, it has limitations. Now, the commonest conditions for which people come for homeopathy are usually either autoimmune conditions like multiple sclerosis, Crohn's disease, vitiligo, psoriasis, And so many rheumatoid arthritis, ankylosing spondylitis, people come for this, to homeopathy for this. And why do they do that? Because modern medicine does not have a long-term solution. It has remedies, but they are short-term, immunosuppressants, steroids, with side effects, and not curative in that sense. So people come for multiple sclerosis, allergies, eczemas. So these are all illnesses for which I would say even many modern medical doctors, they refer their patients for homeopathy and they come themselves. Because what you said is absolutely correct. You see, we are living in an era of integrated medicine. We are not here to prove the superiority or inferiority. It's not either or anymore.
Correct, correct.
So we need to know the strengths and limitations of each system. But another very important area for homeopathy is children.
Correct.
And
Immunity.
not only immunity, but also behavioral disorders, developmental disorders, autism, attention deficit disorders. You know, what do you do? Suppose, you know, you say this child is very shy. He doesn't go to anyone. He doesn't meet anyone. He can't stand and speak. He's always reserved. He's withdrawn. What do you do? For this, homeopathy has perfect treatment. It can change the very nature of the child. And by change, I don't mean that it gives him, you know, antidepressants or anti-anxiety medicines, but heals the problem within, so that he comes back to health. It is not just a removal of a symptom, it's the change of the whole state of being that becomes healthy. And when that happens, not only the shyness of the child gets better, but his immunity improves. There is a study which shows that if between 0 and 2 years, a child is treated purely with homeopathy, along with some allopathy when needed, and another set of children treated in conventional way, the need for allopathic treatment drastically reduces under
But even
homeopathy.
in ADHD, autism, you've seen a difference with homeopathy?
Amazing difference.
That is really an important discussion to have.
We treat a lot of cases of autism, attention deficit, behavioral disorders, not only in children but adults as well.
Of course.
Yes.
A lot of them are diagnosed a lot later. I mean, you could be having it since your childhood, but you figure out in your late 20s,
Yes.
30s, 40s that you're having something.
Yes.
But, you know, coming to this point, you mentioned one important factor in your discussion, which is long term.
Yes.
For something to work in homeopathy, as in Ayurveda, you have to take it for an extended period of time. And that is where the compliance issue comes in, where a lot of people, either out of fatigue, inertia, boredom, impatience, give up the treatment midway, which then again impacts the outcome. And then rather than saying कि मैंने नहीं लिया 9 महीने या 1 साल जैसे डॉक्टर ने बताया, they blame the discipline for it, कि homeopathy doesn't work. So how do you ensure compliance for it to have the desired outcome?
Your point is absolutely well taken. Now, we have to understand how homeopathy works. And I think it's very important that we explain this to the patient. Then compliance is better, when they know what they are doing, what is happening within them. So I will just explain 2 principles of homeopathy. One is holism. That means treating the person as a whole. And the second is individualism. That means treating the person as an individual. I'll just give one example. Suppose a person comes with rheumatoid arthritis or he comes with asthma, whatever it may be. Now, we say arthritis is a joint problem. Asthma is a lung problem. And you have another specialist. You go to either a rheumatologist or a lung specialist. But is really rheumatoid arthritis a disease of the joints? Is really asthma a disease of the lungs? It's not true. Why not? Because asthma comes from allergy. It's an allergy. So when you have a dust, when you have a smoke, then the bronchi, which are allergic, they contract. So you cannot breathe. Rheumatoid arthritis is a disease of the immune system, which manifests in the joints. It's an autoimmunity.
Correct.
What is autoimmunity? Autoimmunity means the body's defense mechanism is fighting the body's own cells. It is like your watchman, instead of fighting with a robber, is starting to hit you all the time. right?
Correct,
This
correct.
is what is autoimmunity.
Correct.
Now, what does modern medicine do? You have arthritis. What do? Go to a rheumatologist. You get steroids. You get immunosuppressants. You get painkillers. You get anti-inflammatory medicines. What does this do? It puts your watchman to sleep. So you're hitting
Suppression.
me. You go to sleep. Now, what happens when the watchman sleeps? Two things happen. One is the thieves come in anyway, so your immunity has gone down, you get infection. And what's the second thing that happens? When he gets up, he starts beating you again because nothing changed inside of him. He was just sleeping for that time.
Correct.
That is why in modern medicine, you have to keep taking the medicines lifelong for almost all conditions, all chronic conditions, whether you have hypertension, diabetes, asthma, arthritis, eczema, psoriasis. You just keep taking medicine, keep putting him to sleep. And then the third problem, side effects.
Absolutely.
So what is the solution to this? If we explain this to the patient, then a second thing happens. Can we correct the immune system? Can we correct the functioning of the immune system so that no longer he is going to beat you, but rather beat the thief, right? But now, there's a very, very nice thing I need to say, that the immune system is a part of an overall system which is called psycho-neuro-endocrine immune system axis. This is like a cabinet of ministers.
Okay.
The prime minister is the mind, defense minister is the immune system, communication minister is the nervous system, health, the home minister is the hormonal system, endocrine system.
Right.
They are the central controlling systems. And this is not homeopathic language. This is modern medical language.
Right.
It is fully recognized that the psycho-neuro-endocrine immune system axis controls all the systems of the body, and the problem there results into arthritis, into asthma, into this, into that.
Correct.
How to correct that?
The core, the root cause.
The root cause. That you have to correct by understanding the person's mind, understanding his nervous system, understanding his hormonal system, how he eats, how he sleeps, how he thinks, what he likes, what he dislikes, how he reacts. When you understand the individual as a whole and then match the remedy, homeopathic remedy to that individual, then healing happens at a very central level.
Which is the second part, the individualism.
Yes. And when the healing happens at the center, the parts heals. But it takes time. It's not a painkiller that is going to give you instant relief.
Correct.
Over a period of time, your entire system is going to have an overhaul. It's going to clean up. It's going to come back to health. And that takes time. Now, when we explain this to patients, number one, and number two, when they see other patients getting healed, I'll tell you one story.
Sure.
Long ago, 25 years ago, one patient came to me and he left. After I took his new case, he left. But in those times, there was a postcard, He had left that postcard inadvertently in my office. Curiosity killed the cat. I read the postcard in which somebody had referred him to me. And he says, you go to this doctor. He will take a very long history. He will ask you questions. You will not understand why he is asking what you eat, what you don't eat, what you sleep, how you dream. He will ask all irrelevant questions. Just answer them. Then he will give you small pills. You will say, what? What is this little pills? What it is going to do to me? Just take it.
Yeah.
3 months, nothing will happen. Just bear it. And then you will be okay.
So you prepped him well.
So people who get healed, when they refer other
They're the best
people,
ambassadors.
they come with the idea that I'm going to heal here. And then the compliance happens. So in my case, I don't have an issue that patients are not compliant or they are not patient because we explain everything.
Yeah.
We even refer them to cases who have been healed. So we
That's
have
like a support group system, which is very common in the US, where you talk to others who have healed, and that support group system is lacking in India. So you bring that in by connecting them to others who've healed and who benefit.
Also we give what is called patient awareness seminars, where we talk about homeopathy, what it does, why it does, how they have to report
Very
the
nice.
symptoms, right? And then they introduce to other patients who have healed. So then compliance is good.
The reason is you're spending that time. Like, what did you say? The whole holism concept is you have to understand everything. How they eat, sleep, everything, right? Like, don't like, what's going on in their head, their dreams. And that needs time, right? So when you're taking that history for the purpose of holism and then connecting it to the individualism, it takes anywhere from 1 to 2 hours to take that history, whereas there was a statistic to show that a modern conventional clinic, when you go to a doctor, the average time they spend with the patient is 2.5 minutes, right? So 2.5 minutes versus 1 to 2 hours, you're almost playing the role of a counselor. And I think that's where then that patient gets a conviction, and then that leads to compliance. I think that's beautiful. But what about people who are not willing to invest those 2 hours, or people who have privacy concerns and don't want to discuss their private dreams and likes and dislikes with you? Have you faced that as a bottleneck or friction point?
Very rarely.
Really?
Very rarely. Patients come and they are so happy to, speak. And many of them said, we have never shared this with anyone in our life. You are the first. And then they are so happy to have shared that. But I want to tell you one more thing. That very often we say that, there are privacy concerns and patients don't want to reveal things about themselves. The secret is, the homeopath doesn't want to know your story. He doesn't want to know your secrets. If you tell, he will happily hear it. But he is not going to probe you and tell me what did you do and what did you do, and no, this is not the story. The idea is not to know the person's story, but the person's experience. And there is a big difference between that. And we have a lot of techniques in case taking where we can get to that experience without getting to the story, if necessary. If the patient is not keen to reveal the story, we have other ways around it. But we want to get to that person's experience. I want to explain that for just a minute more.
Yeah, please do, because I'll tell you at a personal level, the reason after Dr. Nam Joshi died, I've not gone back to a homeopath is because I do not want to discuss anything about myself that's private with anybody. I find it difficult even to do it with close friends. Though I may talk a lot, I don't like discussing my private issues. And that's always been something that stopped me from going to a homeopath.
I understand. But it's not necessary. We don't want to make anybody uncomfortable, and we have many ways around it. So you don't have to discuss what you don't want to talk about.
But then do you get the holistic idea about the person?
Absolutely.
Okay.
And I'll tell you why.
Yeah.
Because you see, the problem, we say, in medicine, we say stress causes a lot of problems. Stress causes blood pressure, heart attack, diabetes. It aggravates everything. What is stress? Now, very often we say stress is because of this person or this situation or that situation. He is the stress, that is the stress, money is the stress, health is the stress, my daughter is the stress, right? Often my spouse is the stress. That we don't want to go there right now.
Ghar ki kahani.
But actually stress doesn't come from any of this. Stress comes from the way we look at the situation. And this differs from person to person to person. And that, the way we look at something, somebody can look at it in a very aggressive manner, somebody can look at it in a withdrawing manner, somebody can do anything else, you see. It's the same boss but 6 employees, they react completely differently.
Correct.
One will react from insecurity, one will react from anger. So it's a very, very individualistic perception of the stress. And that's what the homeopath is trying to understand. Because from how you perceive the stress, we are able to know what your remedy is. Do you belong to a plant kingdom, a mineral kingdom, or an animal kingdom? So our remedies come from there. So if your reaction is one of sensitivity and reactivity, it is plant. If it is one of losing structure, it's mineral. If it is one of competition, it's animal. Suppose there is a girl, we get so many young people, heartbreak. You know, he used to WhatsApp me morning and evening. How are you? Did you sleep? Did you eat? Did you do this? And suddenly he blocked me. What? Common story.
Very common.
Very common.
Yeah.
But how does one girl, the second girl, and the third girl react to this?
How would the three react? Giving the examples of plant, mineral, and animal.
The first one is shocked. How did this happen? I'm frozen. I'm numb.
yeah.
I can. This is plant.
Yeah.
Whereas the mineral one will say, you know, I depended on him so much. I trusted him so much. He was the only one I could share everything with. I had built my whole life around him, and now it's all collapsed. I have lost something. And the third one will
But how
say,
is the mineral different than the plant? Because both are saying the same thing. It's a form of shock.
no. The first one has the experience of shock, like this,
And the second one is looking at it more logically.
structurally.
Structurally. There's more structured thinking.
I lost something. I lost a companion.
Okay.
The first one is saying what happened was shocking. The second one is saying that in this I lost somebody whom I needed. And the third one is saying he did this to me.
There's more ego in the third one.
Not ego, competition.
Aggression.
It's a victim aggressor.
Got it.
I will finish him. I will show him.
Vindictiveness comes in.
I will show him.
This is a very nice example, very common example to
Common.
explain the three kingdoms.
Three kingdoms.
Beautifully.
Yes.
That's very nice. But doctor, almost when you're talking and you're taking the case history, it almost seemed like it's not a science, it's an art. And the practitioner has to have the ability to take the right piece of information. Now, when something is not so much a science but an art, it requires a lot of training and experience.
Yes.
So are the homeopaths in India having a structured mechanism of taking the case history effectively, getting trained adequately? Because, a few bad apples can ruin the reputation nicely created by a lot of good apples like you.
Well, thank you for calling me a good apple.
You wouldn't be on this show otherwise. I've done my research.
Well, homeopathy can be practiced at different levels. Just like music, you can go into the bathroom and sing and the neighbors can complain. So you can do music at that level.
Yeah.
Or you can do it at the level of Bhimsen Joshi classical music. And there are many levels in between. Homeopathy is like this. What is practiced in a very mass scale is a very simplistic form of homeopathy that effectively treats the symptoms. Suppose you get an injury. I can give you a hint. Anybody who gets an injury and a bruise, you can take arnica. There's a remedy called arnica 200. You can take it 3 times a day. Immediately your pain will be better. Okay. So this level of homeopathy is practiced by all grandmothers in India in a way, And then you go more and more classical, more and more specialized.
Deeper issues, chronic
Now,
issues.
as you go higher, it's going to be less and less people practicing that.
Correct.
And there where the art comes in.
And the specialists come in.
That's what is called as classical homeopathy or unicist homeopathy, where the one remedy is chosen for a particular patient, for a particular person,
Right.
and not a combination. Many times homeopathy is practiced in a very superficial manner, which is effective temporarily.
Because you're commoditizing it.
Yeah.
Basically.
You can make a homeopathic toothpaste. I mean, who is going to stop you, right?
Absolutely,
But that is
absolutely.
like using the Kohinoor diamond as a paperweight,
Which is why you and I discussed that in my earth, I cannot come up with a homeopathic supplement because it just wouldn't work. So I think you cannot commoditize and
Yes.
make a one fits all when it's a very specialist approach to treating somebody. I get all of that, but I'm going to come to a controversial question now, which is a lot of people say that it's 1% active ingredient, 99% alcohol, फिर वो dilute करते करते वो 1% active भी कम हो जाता है. It's all placebo. It's just sugar pills with a little bit of alcohol mixed in. There's a lot of negative talk on homeopathy by homeopaths as well. We spoke about one of the homeopaths who went to a popular talk show and spoke rubbish about homeopathy. So I want you to counter the placebo effect with your experience and with evidence, both.
The question is absolutely valid, and it's a big question in the medical fraternity as well. There are 2-3 replies to this. Number one, it's definitely that the homeopathic medicine is ultra dilute that beats logic. Okay. Does it still have effectiveness? So some studies have been done for that. There's a very famous scientist called Luc Montagnier who actually discovered the HIV virus and he was awarded the Nobel Prize for that. So he did some experiments with homeopathic dilutions and showed that even at a very big dilution, there is effectiveness of homeopathy. You will have to read up about him.
Okay.
Similarly, experiments were done by a scientist called Jacques Benveniste. And similarly, in the laboratory, he was able to show the effectiveness of these dilutions. Yes, they are all published. They are all published.
Is it done on a pretty reasonably large patient population?
It's not on a patient. It is in the laboratory that they were able to show in the dilution there was still effect.
But are there any publications which are done on a larger set of patients, which has been published on something like a Lancet or a Nature or a British Medical Journal, you know, the ones that are more commonly referred to, where you can say that this is actually a trial conducted, a gold standard with a large number of patients that shows evidence that it has worked?
There are. I just brought one of them with me here.
Sure.
So this is a journal called Advances in Integrative Medicine. It's a very recognized journal. And I published a paper here last year showing the effectiveness of homeopathy in COVID. So this is a very rigorous scientific trial conducted in 4 major hospitals in Pune, where we took 150 patients of COVID.
150 patients, that's a very large number.
Of COVID, put them on homeopathy and 150 patients on placebo.
So total size was 300.
Yes. Everything else was the same in both the groups. And this was done in the hospitals like Ruby Hall and other big hospitals in collaboration with the doctors there. So the co-writers of this paper are allopaths.
Oh, so the MDs and all writing this with you?
Yes, they are all intensivists in the hospital. Right. So it's a joint collaborative paper.
And what was the outcome or what was the key takeaway of this?
Very significant difference between the homeopathic and the placebo group. Just to tell you that the fatality rate was nearly 10 times lesser in the homeopathic group.
10 times is a big number.
And similarly, ventilatory support and ICU admission in the homeopathic group was significantly lesser than in the placebo group.
Why is it that more people don't know about this? I mean, I'm one of those who's a chronic consumer of content online and I read a lot. Why do I not know about this?
You can go in the Google and just put my name, Sankaran, and put COVID and you will find the study. It's it's openly available.
But I still feel that, this is a zamana of a little bit of overt and extra marketing. So I just wish that all of you as a community would market this kind of a gold standard 300 patient study a bit more. Maybe we've achieved that on today's podcast.
I want to tell you, homeopaths are very bad at marketing.
Oh my God, but that is like, it's marketing these days is as important as breathing. And you're a storyteller. Marketeers are all storytellers. So a person like you who's so good at telling stories, whether it's a Watchman or the Buddha, I think using stories as a medium to get it to the common person at that level of marketing is a must, doctor.
I want to add one more thing. There's a famous breast surgeon in Pune, Dr. Kopikar.
Yes, of course, I know him.
So he and I collaborated on a research trial of a condition called granulomatous mastitis, which is an inflammation of the breast that looks like cancer, but it's not cancer. It could be autoimmune. But in modern medicine, there is very little treatment for it. So he said, can we try homeopathy? We took 30 consecutive cases of granulomatous mastitis that he referred with every sonology report and pathology report, biopsy report, established cases of this condition and sent it to us for homeopathy. We have collaborated on that research. And I want to tell you that every single one of those patients recovered with homeopathy.
Fantastic. And doctor, this is something that you need to do more. I know Shukruta is doing more podcasts on homeopathy. If you can get an allopathy doctor along with you to sit and discuss these kind of case studies or stories with evidence, it would go a long way.
I want to tell you one thing. One of the greatest joys of being in India is the openness of modern medical doctors to homeopathy.
Oh, that's wonderful.
I have so many friends among them and they are so open. They refer their patients to us, just as we refer our patients to them. You know, this is beauty. It's not, here the philosophy is not, if I am right, you must be wrong. This is not India.
Yeah.
I can be right, you can be right too. And this is the difference between India and the Western countries, where they are like
Closed. They're
No,
a lot more closed.
they are fighting with each other.
And then that defeats the whole purpose of the very word used here, which is the most important word, that is integrate. You
Right.
cannot have an integrative approach if you don't have that level of collaboration and respect, mutual respect.
So what I really, through this podcast, I would appeal to modern medical doctors to come forward, to collaborate with us on research. Because there's no point saying there is
Absolutely.
no evidence when you don't allow us to do the research.
Right.
Right? I have knocked for this COVID paper, I knocked on so many doors. For 4 months, I beat my head against Ayush Ministry, Health Ministry, IMA to allow me to do homeopathy in a condition in which there was no treatment at that time.
Correct.
All that remdesivir and all was not really effective.
Guilty.
It was. So when we have something,
Yeah.
what do you lose? And it has no side effects. Homeopathy has zero side effect.
Yeah, absolutely.
Right.
I think that's double click on that point. It's very important to talk about that, because no side effects is a very big USP, a very big marketing point that needs to be spoken about. One last question, doctor. You're a Zen doctor, because I follow you on Instagram. I've seen your YouTube videos, and you've written lovely books like Manji, which is one of my favorite books. You shared your personal stories to talk about the importance of breathing, meditation, leading a life where you retire your ego. Can you just talk a little bit more about that as parting words, so people around us can get more inspired to lead that kind of a life?
There cannot be better parting words than that. So basically, homeopathy is a part of a perspective of life, where it is a holistic approach. It's a lifestyle approach. It has to be a part of that. You can't pop in the pill and continue to do all the nonsense that you're doing.
Right.
So I believe in physical, mental, social, and spiritual health. And we have to work on all these 4 aspects in ourselves if we want to heal and maintain our health. A homeopath can give you a head start, but it's not going to take you too far if you continue to put kerosene into your car instead of petrol. If you are going to load your car with 500 kilos instead of 100 kilos with obesity,
Correct.
it's not going to last too long. If your attitude of life, you need to have a purpose that is higher than yourself. You need to have a community. You need to have a spiritual orientation. You need to find peace in yourself. And what better land than India?
Absolutely, where you have this spoken about in abundance. Tell me, again, connected to this, 3 lifestyle changes that you would urge people to make in 3 areas where you feel there's the most deficit in our country, in spite of it being the land of abundance, openness, and spirituality.
Well, the first is diet.
Diet.
I believe strongly in a vegan diet, in a animal-free diet. No pesticides, organic diet, no refined food, oil, sugar should go.
Why animal free?
Because studies have shown that a vegan diet is helping in many, many conditions. And I know this from my experience.
That's one, the diet.
Diet, exercise is very
Exercise, of
important.
course.
Regularity of habit, sleep, waking up. Then awareness. My main philosophy in life is be aware.
Live in the moment.
Live in the moment, yes, but also be aware. Don't always react. Don't be in a reactive mode. Take a little step back and watch what is happening. The thoughts that flow in your mind, the emotion, they're all going there. But you take a step back. Watch yourself. Watch what is happening. Be in the witness mode. And from the witness mode, you can graduate to silence. This is the first step. third is to have a meaning and purpose in life.
Correct.
A purpose that is bigger than yourself. That's what keeps you going. And finally, what we call as satsang. Hear spiritual people. Hear them talk about what is life. You know, we are all born, we are all going to die. So what do we want? What are we taking with us? Which credit card will work after our death? Think about it. When you accumulate all this and you say, I want, which fame is, and you know, which is going to go up with you. So can you live in that? Connect with nature, connect with music. Music is a powerful healer, right? So live healthy. Live healthy. You know it. People know it what it is, but they are doing the opposite. They know what they should not eat, but they eat it.
Correct.
They know they should not stress, but they stress about unnecessary things. So just be aware and bring some changes slowly, not overnight.
Absolutely. You know, this is fabulous because I think in this podcast you spoke not about the objective, which is all the evidence and the publications and the principles, but you also spoke about the subjective and, you know, the Zen, the philosophies, and I think balancing the two is so important. So I think that brings us to the end of a fabulous conversation. I always tell my doctors that this is not a podcast, this is not an interview. You're belittling it by giving it those labels. I think this is just a very, very beautiful conversation between two people, like you said, tied to a higher purpose of education, awareness, again with a higher purpose of helping others. So thank you for being a part of this conversation. And I learned a lot from you today. So I hope a lot of others watching learned too.
Thank you for inviting. Thank you for being open. And thank you for being a medium of spreading this message of good health, you know. Depend less and less on pills. And
hey, I still have to keep my job at MQ.
You learn to awaken the healer within you.
Yeah, absolutely. You know, so beautifully said. So beautifully said. And thank you for a very important reminder towards that today. And we look forward to a session 2 on homeopathy where we'll get Dr. Kopikar with you and one more allopath with you and discuss the evidence gap that you just spoke about. But for today, thank you very much, Doc. It's been an absolute pleasure.
Okay.